Tonight, Emma Webber's 19-year-old son Barnaby and two others, Grace O'Malley Kumar and Ian Coates, were killed in Nottingham by a paranoid schizophrenic. A new report out today into the care of their killer outlines major failings. Emma's here, along with another mum who tells us she fears her son could harm someone because his care under the same NHS trust, she says, isn't good enough. Hello, welcome to Newsnight Live from Broadcasting House. We have interviews and insight for you as always. And later we will be discussing Sir Keir Starmer's lockdown visits from his vocal coach. As the Met say they won't investigate, what will the opposition do next? But we begin tonight with a report published today that details the painful failings and errors in the care of a paranoid schizophrenic who in the early hours of one June morning in 2023 attacked and killed 3 people with knives. 2 19-year-old students and a 65-year-old school caretaker. We'll talk live to the mum of one of those students in a moment and hear from another mum who fears her son, in the care of the same trust, could end up harming someone. First, here's what happened that morning.
This is the moment Valdo Calacane, a killer who caused carnage on the streets of Nottingham, was caught.
Ilkeston Road early this morning.
There's been a stabbing on Ilkeston Road. There's somebody lying in the street. I think they're dead. Oh, that was awful.
2 19-year-old students from Nottingham University were found here, stabbed to death. One has been named locally as Barnaby Webber.
Grace O'Malley Kumar from London wanted to follow in her parents' footsteps and become a doctor.
CCTV picked up Calacane walking the streets for hours beforehand.
He tries to break into a building housing vulnerable adults, but is pushed off by a resident. The suspect then stole a van from a man who was also found dead from knife injuries.
65-year-old caretaker Ian Coates.
He drove the vehicle to the city centre, where he then drove at members of the public.
The woman went on the curb. The man went up in the air. It was such a bang.
Minutes later, the van is tracked down and the killer is arrested.
In January, he was given an indefinite hospital order for manslaughter by diminished responsibility after Nottingham Crown Court heard he had been diagnosed with paranoid schizophrenia.
Your sickening crimes both shocked the nation and wrecked the lives of your surviving victims.
Valdo Calacane was sectioned 4 times, the first in 2020. In the end, they discharged him.
Today's report, commissioned by NHS England, says the risk that Valdo Calacane posed to himself and others was not fully understood, managed, documented or communicated, and that he wasn't seen at all by mental health services in the 9 months up to the killings because they discharged him to the care of his GP. They discharged him because he'd stopped engaging with them. Let's speak to Emma Webber, who is the mum of Barnaby. Thank you very much for being here this evening. I know you've had a very long day.
Yeah.
What is the main thing that you take from this report?
It's an appalling horror show. It's part of failings, negligence, mistruths on such an epic level across multiple agencies, 2 police forces, an entire mental health trust who failed so appallingly that my child is not here anymore. Missed opportunities countlessly. And hearing what you had to say, putting it into my words, they just didn't do their jobs properly. And so what we've had to go through today is part of a very, very long, painful, torturous process.
You also had to fight for the full 300-page report to be made public.
Yes.
Why?
That's a really good question. And it's shameful. It's shameful to the NHS. It's at every single part of this path, every single corner, every single door, we've had to fight for everything. We've had to fight to be listened to. We've had to fight to have the investigations, the reports. We've had to fight against the terms of reference. We had to fight to get this unredacted report. Like, we should have been grateful 3 weeks ago when it was presented to us. We were told in no uncertain terms that the NHS would not go against the law of the land and provide this detailed report into the public domain. And then at the 11th hour, only yesterday they did, because we fought and we've put ourselves out there once more to ensure that clarity happens, that the truth happens, and that organisations and individuals are held to account, not just the NHS.
Yeah. And when you say held to account, what does that mean? Because it's not about you wanting to name and shame the professionals who treated Callacane.
No, absolutely not. And I'm really glad you asked that, because it's so important that it's not a witch hunt. We're not here with pitchforks. I don't want to know the names of the people that have so badly failed in their decision making and leadership. What I do want and will demand, and I know the other families are in complete agreement, is we do want accountability. And that means if you don't do your job properly, then you're held to account for it by your professional body, by your employer, by whomever.
So are you saying there are some people who failed who are still in their roles?
To the best of our knowledge, yes.
Right.
Yeah. We don't believe there's been any direct action against anybody in the NHS, in Nottinghamshire Mental Health Trust whatsoever.
Even though they've acknowledged now this is another report which lays out the failings. I'm going to read to you the statement from Nottinghamshire Healthcare NHS Foundation Trust, which was released today. They say, once again, our deepest condolences go out to the families of Valdo Callacane's victims who died, Ian, Grace and Barnaby, and to the victims who were injured by him. We apologise unreservedly for the opportunities we missed in the care of him. We accept today's report in its entirety, including its findings and recommendations. We're making clear progress with a trust-wide plan which is already delivering key improvements in areas like risk assessment and discharge processes. I know that this will never undo the catastrophic damage caused by these events, but we will do everything possible to prevent similar incidents happening again.
It's white noise.
Why do you say that?
I know I sound so angry, and I try to control the emotions because it's really important that we come across as reasonable as possible. But this isn't the first report. If 100 Families is a charity set up to support victims, families and victims of homicide, of murder through mental health, like this, it's the Callacane. There are 600 reports on that website that are NHS reports over the last 30 years. They all say similar things. It's repetition, but what doesn't happen? There's no action. It doesn't get any better. If anything, it's getting worse. I find that so insulting, to have the unreserved apologies, the lessons will be learned. It is white noise. Enough is enough.
Can I ask you, Emma, how you rationalise bringing up a little boy, getting him through primary school, getting him through secondary school, you get him to university in his first year, and then he's taken from you?
Yeah. His life wasn't lost. He was stolen. He was taken. He was taken by somebody, in our opinion, who knew exactly what he was doing, was mentally unwell, but he had insight, and he wasn't held to account for murdering my child. I said earlier today, in September 2022, Callacane was discharged with no risk assessment. You've alluded to that. I won't go into more detail. He was just released into the community. In September 22, there was a warrant issued for his arrest because of the violent assault previously, one of many, this time on an emergency worker. But importantly for us, in September 22, we took our 18-year-old to Nottingham. We took him to a city that wasn't safe to have him. We didn't know that. We didn't know that 6 months and a bit beyond later, evil would be waiting in the shadows for him and for Grace, and then later on for Ian. And you can't help but feel guilt. And
You
I know
feel
that's
guilt.
irrational. I know that's irrational, but it's, I'm a parent, I'm his mum, and I couldn't stop this. And I have to live with that every day, and I know it's irrational.
I don't actually think it is irrational.
No,
I think it's really
that,
rational.
I think it's the parental perspective, but from a mother's perspective, it's that invisible umbilical cord. And never underestimate, as calm as I may appear, as calm as the Kumars may appear, and the Coates boys appear, the white-hot fury that runs through our veins. Because of the injustice, because of the misjustice, because of the lies, the mistruths and the negligence. And we can't begin to grieve our catastrophic loss. We can't begin to grieve because we're fighting. We're fighting just to get the truth.
You said Callacane hasn't been held to account for the murder of Barnaby and Grace and Ian. He is in hospital indefinitely. It's a hospital order. He was convicted of manslaughter on the grounds of diminished responsibility. Do you not see that as him being held to account?
No. No. That's the result of a poor investigation, a flawed investigation and a weak prosecution. There's evidence in here that goes directly against what was presented at court by the expert witnesses, those doctors. The reason he isn't in receipt of a hybrid order, which is what he should be having, is because he was deemed to be treatment resistant, which means the medication didn't work. The level of medication he needed, as the judge says in his summary, he could never be in a prison. He could never serve any time in a prison because he wouldn't respond to his treatment and would pose too much of a risk, so he had to be in hospital. To hear words like, unlikely he will ever be released, an indefinite hospital order, again, that's a complete and utter mistruth. The stark facts are, Victoria, that indefinite hospital orders, 98% of people that are given indefinite hospital orders are out within 20 years, and over 80% are out within 10 years. We were talking widely in this country, quite rightly, recently about Southport, about only getting 52 years. I agree, should be whole life order. That monster should never come out. But we're faced with our sentence of this murderer responding to treatment. He is getting better already. That's been evidenced. He did respond to treatment whilst he was sectioned of the 4 times every single time. But it's likely he'll be out. How can that be right?
Emma Webber, thank you very much for talking to us and to our audience. We really appreciate it.
Thank you. I appreciate being heard.
Thank you. And just to say that Nottinghamshire Police, in terms of your criticism of them, they say in accordance with existing protocol, we are unable to comment directly on matters which are included in an independent police investigation which is ongoing into the matters that we have been discussing. Thank you very much, Emma. Thank you. Let's hear from another mother, one whose adult son has been sectioned 3 times and is currently in the care of Nottinghamshire Healthcare NHS Foundation Trust, the same trust which has been found to have failed so badly in the care of Callacane. This mum is worried that her son poses a risk to himself and the public. She's talking to us anonymously. We're calling her son Robert. It's not his real name. It's to protect his identity. And I asked why, as his mum, she wanted to speak to Newsnight and to you this evening.
Robert's care, you know, and he's been in hospital now 4 times. It just wasn't, he wasn't moving forward, and we felt useless really. We couldn't do anything. And when I read about I was sat at home reading the Callacane case thing, I thought that could be Robert. So I was very upset, and I just wrote, and I've complained to pals, I've complained to his mental health service that nothing's changed, he's not getting any support, and I can't see any future for him really.
And when you say your son Robert could be Callacane, what do you mean by that?
Well, when he gets ill, he doesn't really, he becomes psychotic really in his ways, but he doesn't recognise it. And he was very rude to us. He pushed his friends away, very aggressive. He attacked people, and even when he was detained, he was attacking people within the hospital. So really, we were lucky he didn't do any real damage to anybody, himself and anybody else. He could have, you know, done something that was worse than just hitting them. So my worst fear is that it'll spiral when he does get ill, and he'll hurt somebody or somebody will hurt him.
One of the things that came out of the Callacane report that's been published today is that Callacane's family were not involved enough in his treatment. They could have been co-producers, they could have helped with the care and treatment. It's the same Nottinghamshire Healthcare NHS Foundation Trust treating your adult son. Are you involved? Are you part of it?
We tried really hard. They took him off his depot injection.
That's a longer acting antipsychotic injection.
They took him off his antipsychotic medication and gave him oral meds to take. We said to them, don't do it.
So they gave him tablets instead?
They gave him tablets,
yeah.
But they didn't supervise him taking the tablets. And we could see him getting very, very quickly, behaving more erratically, not being very attentive, pushing his friends away, being quite, becoming more aggressive. He had a job, he had a car, and we kept contacting the mental health team, telling them, you know, there's something wrong, they weren't listening. I must have phoned 100 times.
Seriously?
Seriously, 100
You contacted
times.
the mental health team who were looking after your son 100 times?
And they wouldn't speak to me because he said, don't speak to me.
Right.
He told them not to speak to me. I phoned the crisis team several times, and within a week he was detained by the police.
So when you can see your own son unravelling, you're telling them he's not taking his tablets, and you're saying they're not listening to you?
In that week he was detained, my husband said, he phoned them and said, look, he's really, really bad. And the people on the other end of the line said, well, that's very interesting. And that was it.
You're joking?
No, that was it. You know, we were putting the key in all doors and turning them slightly so he was so aggressive and rude to us and swearing and really out of control that we were putting the keys in the door so at night time we felt safe, we could sleep.
Now, in response to the Callacane report today, Nottinghamshire Healthcare NHS Foundation Trust said, we are making clear progress with a trust-wide plan which is already delivering key improvements in areas such as risk assessment and the discharge process. What do you say to that?
I mean, the head of the clinical lead did phone me and apologise because I did complain to the service.
Apologise for what?
For their lack of response, basically. And he did say he'd do more when he came out. So now he's been seen twice a month. But really, I feel as if it's not enough. He's got no trust in the service.
This is Robert.
This is
no
Robert.
trust in the service,
No trust
right?
in the service.
So how would you summarise the kind of care and treatment you see Robert getting for his psychosis?
Inadequate, really. They've just really not done enough, and they should be thinking more outside the box, trying to help him move on with his life. It's just a sticking plaster, and he's not going anywhere. It's going to happen again and again.
What is your message to the Trust tonight?
I don't want to be nasty with them, and I don't want to, be pointing fingers. That's not what I'm about. I want them to be better at what they're doing, and what they're doing for Robert just isn't good enough. It's, and it's going to happen again and again. So they've really, really got to think about how they deliver their service for each individual.
And this really feels like a warning from you to them about your son.
Oh, definitely.
Is that fair?
Definitely. And we're lucky that nothing really untoward happened.
Thank you very much for talking to Newsnight. Thank you. And the Nottinghamshire Healthcare NHS Foundation Trust say they can't comment on individual cases, but say we always take concerns raised very seriously. We'll work directly with the patient and their family to resolve any issues. Once again, we'd like to reaffirm our commitment to improving our services and ensuring all our patients and their families receive the care they deserve and our communities feel safe. Next, did Sir Keir Starmer break lockdown rules as leader of the opposition when his voice coach came to his office to advise him on December the 24th, 2020, as he considered his response to Boris Johnson's Brexit deal? Well, the Prime Minister was asked at PMQs today to repeat his assurances that all COVID rules were followed back then by him and the voice coach. Here was his reply.
Mr. Speaker, in December 2020, I was in my office working on the expected Brexit deal. With my team, we had to analyse the deal as it came in at speed, prepare and deliver a live statement at speed on one of the most important issues for our country in recent years. That's what I was doing. What were they doing? Suitcases of booze into Downing Street, partying and fighting, vomiting up the walls, leaving the cleaners to remove red wine stains. That's the difference. I was working, they were partying.
Let's introduce you to our panel this evening. Former Tory MP Deanna Davison and Labour MP for Great Grimsby and Cleethorpes, Melanie On. Welcome both of you. And Nick, what is the claim against Sir Keir Starmer over this?
Well, Vic, this comes from a scoop in a new book out about the Labour government called Get In, and the scoop is that Keir Starmer had a voice coach in opposition, Leonie Mellinger, and she told the authors of that book, as you were reporting, that in Christmas 2020 she went to London with a face mask and advised Keir on his response to the Brexit deal. Now, at that time, London was in Tier 4 COVID restrictions, which meant, it said, everyone must work from home unless they are unable to do so. But Leonie Mellinger said that she was a key worker. Now, I have the list of key workers under that section, key public services. I was a key worker, you were a key worker, we could go to work. And it looks like where she was covered is if you were administrative occupation essential to the effective delivery of the COVID-19 response. So what that means is ministers making statements in Parliament, opposition politicians making statement and their support team. That seems to be where it's covered. And today we learnt that the Metropolitan Police are not going to look into this because it falls outside the 3-year time frame, because it was more than 3 years ago. So it looks like there's no legal jeopardy to Keir Starmer. But what there is are political questions. Is Keir Starmer, who was so strict about being strict during COVID, that he really felt that a voice coach was an essential key worker during the pandemic? That's where this has ended up.
Melanie On, is Sir Keir Starmer a hypocrite?
He isn't. He was working, very clearly working, and that is a stark contrast to the Conservatives, who we know were conducting parties at that time.
Do you think people who weren't allowed to see loved ones during lockdown would accept that a voice coach in his office advising him on the Brexit deal was necessary for him to do his job?
I think it's very difficult if you're comparing those two things. Being in government, obviously, or being in opposition at the time, that was part of his wider team, and it is very difficult.
A voice coach was necessary for him to do his job.
Very difficult when it's family members, and I understand it. It was really challenging for people who didn't see their families. I didn't see my family for a very long time.
But so can you understand how a voice coach would be necessary?
But I can understand why there is when people are working and there's a big occasion, that support in delivering a big speech was dealt with in the way that it was.
So you think she was a key worker?
I think that the police have decided that there is no further action to take, and the description that Nick has given...
That's because of the time limit. Do you think she was a key worker?
The description that Nick has given indicates that she falls within those guidelines.
Does it smell right to you?
Well, all of this is, I think, is unnecessary.
Does it smell right to you?
I think that if there is an issue, that Keir Starmer absolutely will stand up and say, if there is an issue, let's investigate it further. He has been very clear, if he is ever accused of any wrongdoing, that he'll tackle these things head on. He has missed the rules on these things. He has done in the past.
He chose not to say today again that rules were followed.
And well, I think that the indication from the fact that that the police are not conducting any kind of investigation.
That's because of the time limit, Melanie.
And the rules here that have just been explained do cover her in this instance.
OK. The Met Police, Deanna Davison, will not be opening an investigation because 3 years has passed, as Nick explained. Is that the end of it?
I don't see how this is the end of it. I don't see, as a politician, when you make an entire part of your personality and political character being stickler for the rules, you can't be a lawbreaker and a lawmaker to then not pass the sniff test on something like this. I remember December 2020. I was in London moving flats completely on my own, and I was due to go and see my family. London moved into Tier 4. I spent Christmas completely on my own. That's not a sad tale compared to the tales of so many people. To think a voice coach thought it was fine to jump on a train, travel down in a mask in order to deliver a service that could easily be done by Zoom. Do you need a voice coach in order to deliver a speech about something on COVID? I don't think you do. It's about the substance, not about the delivery. I honestly, on this one, I think it's absolutely baffling that poor Labour MPs like Melanie are being sent out to defend this line, which is completely indefensible.
You were obviously part of a government that was brought down in part by lockdown breaking. Is it hard for the Conservatives to push this on?
I don't know that it is, because one of the big things here is the actual hypocrisy of it. As I say, Keir Starmer made a huge focus of his tenure as being Mr. Rules, Mr. Stick to the rules. And that sniff test is really important, really, really important. He's called for resignations for less than this.
Well, I would say that, you know, you've got a Conservative government who they received fines during COVID. There were parties going on in Number 10 at the heart of government. This wasn't a party, it was work. I think that there is a big difference between people engaging in those sorts of activities, being ambushed by cake, wheeling in suitcases of secret wine from Tesco's down the road through the doors of Downing Street, throwing up in the Downing Street Rose Garden, compared to somebody who is in their office and working.
There's also a big difference between a key worker in the NHS delivering a vital service and a voice coach.
Well, I don't think that
crazy.
Yeah, the definitions around key workers, there were lots of people working on road construction, for example. You wouldn't compare that necessarily with a nurse in the NHS either.
I don't think anyone thought a voice coach was a key worker, though.
No.
Come on, be honest, Melanie.
Well, under that definition, it seems to be that it was, a support team for a ministerial event.
Tonight, the leader of your party, Kemi Badenoch, having said she wouldn't announce any policies for some time, has announced something on immigration. Nick, what is it?
That's right, Vic. This is being billed as the first specific proactive policy announcement by Kemi Badenoch. In other words, it's not saying, I'm going to reverse something this government's do. It's something I'm going to do. And what Kemi Badenoch says a Tory government do is it would double the period of time from 5 years to 10 years before you can claim indefinite leave to remain in the UK. And there'll also be some other restrictions. So if you're applying for it, you cannot have claimed on benefits or relied on social housing whilst you've been here on a visa. You also must be able to demonstrate that your household will be a net contributor. Now, if we look at the front page of the Daily Telegraph tomorrow, they are picking up on that aspect, and what the Daily Telegraph is saying, I think we can see it there where they are, that restricting access to low-paid workers. Now, what is interesting is that Kemi Badenoch's given the impression that we wouldn't have specific policies. I need to build up trust. So is this a panic move in response to For Reform UK and Nigel Farage? What the Conservatives are saying is, look, we never said there'd be no policies at all. What we said we'd do is policies as part of a plan. This is a sense of direction. You can see the direction that they want to go in.
Do you think it's a panic measure, Deanna Davison?
I really don't, and you know me, Victoria, I'll be honest about this if I thought it was. I think ultimately, when you are taking over a new party after a horrible loss, which July was, you do need to take time, take stock, and reflect on the kind of broader policy package you want to put forward. And I think it'd be baffling to think that Kemi was going to sit out for a year or two and then come up with a sort of low-key mid-term manifesto. I think that would have been an absolute nonsense. So I always expected there would be sort of drip-by-drip policy announcements. So I certainly don't think it's a panic measure.
Do you think this will bring the numbers down? Because obviously 2010, 2015, 2017, 2019, 2024, the Conservatives in government said, we're going to bring the numbers down this time. And they did the opposite.
Well, as part of that press release, which I've only loosely digested because it only came out a few moments ago, it does say there will be further policies announced specifically to deal with the numbers in terms of net migration.
They've said that before, haven't they?
Well, they have. But Kemi is a new leader for a new party and a new era, and I think it's important we give her the space to actually announce that herself.
Melanie, you are in a red wall seat. I think I'm right in saying Reform came second in July. How worried is Labour about Reform, particularly on the issue of immigration?
Well, I mean, any opposition is something that governments do take seriously, and Reform obviously are polling very well in the country at the moment, but it's immigration and a lot of other issues that people in seats like mine are thinking about. And then for the Labour government, it's about delivery. And I think for Labour, it isn't about panicking. It is about making sure that people are aware what reforms stand for. That it is about a small state. It is about giving tax breaks to the wealthiest in the country. It is about things like charging for access to our public services, like the NHS.
And it is about net zero immigration.
And it's about, and a big thing on immigration.
I don't mean net zero, you know what I mean.
Yeah.
One out, one in.
And so, so those issues that drive reform, certainly for me, they can't tell me what people in my community care about. That is about good jobs, it's about secure housing, it's about good quality public services when they need it. So immigration is part and parcel of that, and I would say that Labour have taken that seriously when they've come into government, and we've seen record numbers of returns and deportations.
OK. Quick look at tomorrow's papers. The Mirror, failed by the state. Discussing the story we were earlier, Grace, Barnaby, Ian, and also it talks about the 3 little girls in Southport, because there was a review out today into the Southport killer. So 2 big reviews which suggest that British citizens have been failed by the state. The Daily Express failed. Again, it's talking about the Nottingham killer and the killings of Ian Coates and Barnaby Webber and Grace O'Malley Kumar. The Financial Times, Trump's takeover proposal for Gaza condemned by US allies across the world. We discussed that for the whole programme last night. And The Guardian, Trump's Gaza takeover plan faces global condemnation. Thank you very much to both of you for being with us. Nick is back tomorrow with Paddy. Yes, till then, good night.